And welcome back. I'm Mabel, Jong. This is WHCC TV. We're coming to you live from Washington, D.C. And we're talking about venture capital and an evolving role it's playing in the healthcare sector. To talk more about that, Jessica Zeaske, partner at Echo Health Ventures. Nice to see you, Jessica.
Nice to see you, and thank you. It's been a great conference so far.
Terrific. Great to hear it. What is the role of venture capital in healthcare now? We talked a little bit about how it's changing.
Right. Well, the primary role of venture capital is to grow early stage companies. However, I'm from a corporate venture capital. We really look at the strategic role of how we can help companies grow. So when you're differentiating between venture capital, institutional, and corporate, the lines have been blurred quite a bit over the last few years. But when I'm talking about, I'm looking at deals that have a health plan focus, that we really see a drive that's going to be that, and you'll see that from many other strategic venture capitals, funds, where we're really looking is, if you look at the trends, about a third of digital health companies right now who are being funded have a corporate venture or a strategic venture fund associated with them, and about 85% of the exits in the funded companies are going to an enterprise. So startup companies are now seeing, not only do they need the venture capital, but they're also really looking for those strategic dollars to help show them the way of how to work with some of these large enterprises. Healthcare is incredibly complex with the compliance and the regulatory and the slow sales cycles. Therefore, having someone in your boardroom on your cap table to help show you that way is critical.
Okay, are these dollars mostly interested in sort of the sexy areas like the technology and sort of the gee whiz types of gadgets, or are we seeing also this money flowing into the more traditional areas, like how to pay for healthcare?
Right. Yeah, so if you look at some of the trends right now, we have just seen a real spike in emerging new insurance companies. Insurance, insurtech, you would say 10 years ago, very boring. Insurtech is one of the hottest areas. Administrative simplification, when we're really looking at B2B plays, yes, they're boring. Yes, you have to have a lot of expertise to be able to invest in these areas, but they're some of the most promising to drive affordability into our healthcare system, to change the risk profile. Now, there's wonderfully sexy deals out there in terms of precision medicine, in terms of new drugs, new devices, and we're investing in those also, but I think doing a balance of some of that, what is extremely hot versus just the day-to-day, how do we make the system, the trains run on time, is extremely important to invest in also.
And who's involved, the actual players that are involved? Are they actual physicians or nurses or people who traditionally are or should be at the table?
Yeah, so when you're looking at venture capital, the people who are around the table should be trained in how to do venture capital. These are complex financial arrangements. However, bringing in subject matter experts, such as our chief medical officer, as a incredibly valued resource and advisor to that. They could also be sitting on boards and providing that perspective also. But as a fund, as a venture capital fund, we look around the table, and I'm very proud of our fund, Echo Health Ventures, that has an incredibly diverse set of backgrounds sitting around our table, and then with our advisory board also, to really bring in those insights of where we should be investing.
And where's Echo Fund's focus right now? What area excites you most?
Yeah, well, one of the things I said before about insurance and what is the administrative side of that is, again, to keep the trains running on time and make it really work. There's two areas we're really focusing on. One is the consumer navigation and how the consumer is going to be in this very complex world navigating going forward, and trends around that, as well as the incredible trend of providers taking more risk. Especially in North Carolina, they're very focused on that and enabling to do that. Looking at a little bit further, we're looking at precision health. We're looking at continuing to invest in new care delivery models because changing the who and the what and the where care is delivered is critical to driving affordability and access in this country.
In a way, you folks are really trying to hold a crystal ball to see what the next trend is.
Yeah.
What do you think? I mean, you have outlined some of the areas that interest you,
Yeah.
but what is healthcare going to look like through your eyes in maybe 5 years or so?
Yeah, that crystal ball is sometimes a little cloudier than others.
Yeah.
When you say what does healthcare look like, when I start to see some of the
space.
great investments, we're starting to really see investments in the Medicaid space and the Medicare Advantage space start to pay off. When you look at total cost of care, which is something health plans, insurance companies, payers have been, and self-insured employers have been doing for years, is managing that total cost of care. So now as we can get more companies involved in that, whether in an individual vertical, such as an individual disease, taking risk on that, or addressing the total cost of care through Medicaid and Medicare Advantage, those are really where I see we can make some of the greatest improvements in the populations that may need it the most.
Okay, all right. Jessica Zeaske, thank you so much for your time. May I
Thank
ask
you.
how the Congress is going for you?
Well, it's great. I mean, the connections that you can make here is fantastic, and the panels have been very informative. So thank you.
Again, thank you so much.
Great.
And I'm Mabel Jong. Thank you for watching. Stay tuned for more content to come.